And if you're just joining us and you want to know what we're talking about today, I'm talking about the situation that we got in the woulda, coulda, shoulda. And as I mentioned before, I'm going to contact my friend, my good friend, Dr. Bree. She's a OBGYN, and she's going to give us a little more insight on situations like this for the listeners and for this individual here. And this is the voice note, so listen up.
Good morning, Super. Good morning, Shane. Just need some advice because I really don't understand what really going on right now in my life. So fellas, I am 8 months pregnant and my husband wants me to schedule a C-section, and it is not because of any medical reasons or anything that is going on with me per se, but he basically is afraid that, a natural birth will cause my body to change, and he doesn't want to lose attraction for me, and he doesn't want it to affect our intimacy and stuff like that. And I just feel very betrayed. I feel like he does not care. I'm thinking like it's all about him, and he keeps saying that he loves me, but I feel trapped. I feel like I don't have a say. I don't have a say with what I do with my body. I don't have a say with how things go. And I don't even think that he considers the medical effects, things that could go wrong with a C-section, and even post C-section, how much that whole healing process does take. So it's like if I refuse, I don't know what he's going to do. And if I agree, I just feel like I allowing him to take over my life and have a say of what happens with my body. I'm carrying this child, but I feel like I am negotiating my worth and my value as a woman. And I'm at a point where if he can't accept what childbirth does to a woman's body, which he should be aware of because he has sisters, was he even ready for being a father or even a husband? This is disturbing, and I know I'm not the only woman who might be going through this.
Right, so guys, let me just give you a brief introduction to the doc who's online here. We have Dr. Bree online, as she's known on Instagram. You guys could go check her out on Instagram. She's a OBGYN. Her mantra is actually to educate, empower, and inspire. And today, she's definitely going to do that with us here on the Morning Jam. Shane, super. Welcome to the show, Dr. Bree. How are you this morning?
I'm good. I'm just, trying to run out the house, get to work. I have a 15-month-old, so forgive me for being a few minutes late.
Yeah.
It's life.
No, but it's all good, and I realized I was listening, which is great, and you heard the voice note.
Just remind me of it because I just tuned into it, actually.
Okay, so basically this young lady is pregnant. She's married, she's pregnant, and her husband wants her to do a C-section because he's afraid of what it will do to the body. Now, she's saying body in the voice note, but I'm thinking the vagina, all right? The changes done to the vagina. Right. So let's just address that one time. The elephant in the room. Right. A lot of people are worried about natural birth permanently changing the body and the vagina as well. As is it a muscle that actually snaps back after, or some sort of stretching can occur?
Right. So ironically, the vagina is one of the most powerful muscles in a woman's body. That's the first thing I want to let you know and let the viewers know.
Right.
It is a strong area. It's made up mainly of muscle, and as we know, muscle can be strengthened, muscle can be stretched. Muscle can undergo a lot of pressure, and the vaginal muscle is, as I said, one of the most I think it's one of the strongest muscles in a woman's body. For it to be able to stretch, for it to be able to allow a baby to pass through, and then after that, be able to get back to mainly its shape, its natural, how it was before. It shows the power of the contraction. It shows the power of elasticity. It shows the power of being able to expand, being able to adjust, adapt, but also being able to get back to what is normal. And I think that it's a big fear factor that a lot of women have. I think especially men as well, because, their fear is that the activities that follow childbirth might not be as pleasurable as before. I think that's a big myth.
Right.
But I am here to dispel that rumor. I'm here to dispel, any negativity that you may think, especially as a man, after your lady has done her childbirth and gone through all of that. I'm here to tell you, to reassure you that muscle is very strong. It is going to go back to its strength. It's going to, because it's elastic and it's able to expand, it's going to go back into its shape and size. Yes, there are some women out there that have many kids. So you're talking about women who've gone through child labor, let's say more than 4 or 5 times.
Right.
Of course, the muscle may be a little bit, it's harder for the muscle to really, and I don't want to say snap back, because nothing, when it comes to a woman giving birth, our body doesn't just snap back. It takes some time, and it takes recovery. It takes mental recovery, physical recovery.
Right.
It takes us doing exercises. So we have these exercises known as Kegels exercise.
Right.
And, that is designed to help our muscles to really get back to that strength, that tightness, So it's not to be feared. As you were asking about stitching, there are some women that may have to go through, they may get tears naturally, or they may have to go through a planned tear, which is known as an episiotomy. But thankfully, once repaired well, and those women continue doing their strength training exercises, even during pregnancy, it's very important, Kwesi. Before pregnancy, during pregnancy, and after your delivery, if you've maintained your Kegel exercise, you're going to be good. You're going to be good. That vagina is going to really get back to where it was before.
So, in terms of the C-section, because some people might think it's as simple as a tooth extraction for some crazy reason, can you actually give us a walkthrough?
I think the tooth extraction is hard.
Yeah. Can you give us a walkthrough of what happens? Can you give us a walkthrough what happens to the body during a C-section, and how many layers of muscles?
So I think the tooth extraction is difficult. I really don't like to go to the dentist because I think it's a very painful process.
Wow.
But a C-section is a surgical procedure. It's a major surgical procedure. This means that this mom, who has so much anxiety and so much fear going into her pregnancy process, now has to think about, how am I going to deliver my baby safely? What am I going to have to go through? So there's a lot of anxiety leading up to the weeks coming into your delivery. And then to be, having to not know if you're going to have a vaginal birth or whether you're going to have a cesarean section. Because sometimes, the majority of cesarean sections are actually unplanned. So, that means that we don't go into the process thinking we're going into a C-section, but it may happen if we are laboring vaginally and somehow stress happens to a baby, or our pelvis is not allowing the baby to pass through. That's when your doctor is going to be, starting to suggest that you might need an emergency cesarean section.
Okay.
So, to me, beforehand, if you have that conversation with your doctor, and that's what I try to do with my expecting parents. And when I say parents, mom and dad should be together in the room when we are discussing this in the weeks before you're delivering. Go through both vaginal birth, go through cesarean, go through the benefits, go through the risks, go through the expected complications, so that that couple is better aware, right?
Okay.
Because yes, this woman has to now lie down on a bed under an anesthetic, and she has to have about 7 of her layers. So we go through the skin layer, we go through the fat layer, we go through the muscle, we go through something known as the rectus sheath. So that's a connective tissue layer. We go through the womb itself, which is a muscle, and then we go through the amniotic sac to get to the baby. So that is quite a number of layers that a woman has to lie down there, and we have to go through all of that, and she has to go through all of that. And then, of course, there's a recovery period as well. All
right. So, Doc, before you hop to that, so I actually got a WhatsApp message here. I didn't want to read it on air just yet. I was waiting until you join us. So, in this message, this person is actually saying she's opting for the C-section because she wants to save her physique. So, I want to ask, what is she trading off in terms of choosing the C-section, in terms of the recovery time versus when you do a natural birth? And also, is you're left with a scar. How long does it take that scar to heal, and for that whole process to take place? And is it a fair trade-off versus natural birth?
Well, I think to start with, we have to understand that, the reason that you sign up with an obstetrician is that you want to trust that doctor, right? And you want to be able to have an open conversation. You signing up to just do what we call or dad decides that they just have vaginal birth altogether and they want a planned cesarean section. Now, that is something that requires counseling because just signing up for a major surgery where there's no medical indication or no seemingly medical indication, that has to be discussed properly, right? Our patients need to understand risks. It is major surgery. And as you correctly suggested, time to recover. Now, I always like to find women that vaginal birth, right? Not every woman goes into a vaginal birth walking out without without some sort of pelvic. So,
some dropouts there, doc.
That can also come with some discomfort as well. And, especially if you have that stitch in your vaginal area, if you have to use the washroom after your vaginal birth, or if, you have to be walking around caring for your baby, a vaginal birth is not an easy process either. That's a message I want to get out. But, of course, if you're having an incision and it's a surgical incision on your abdomen, your pelvic or your bikini line area, then yes, that is going to take a while. And that actually takes a couple months. I would say I've actually also had a C-section and I proudly stand with it. The decision I made going through labor and having to make a decision in the best interest of my baby. And it took me some time. I am a gym freak and I couldn't even do my muscle. I couldn't even train my abdominal muscles for minimum 3 to 6 months. I mentally I was ready to get back in it, but physically my body was challenged. It was weaker than I thought it would be. Right. So I think it comes down to understanding that childbirth is not easy, and the recovery process is mental, it's physical. You have to have good support around you. As you said, this woman is choosing a C-section. Once she has family members that are going to support her after, my husband was one of my biggest support systems afterwards. Making breakfast for me, walking, helping care for the baby. It's a lot, you're mentally you want to do it, but physically you're limited. And that is where I think emotional support, family support, if you're signing up for it, just make sure you have that support system afterwards. That is so important to your mental health.
Oh man, thank you so
and your
much.
Recovery.
Thank you so much, Dr. Bree. I know today is a very busy day for you, and I want to tell you that we appreciate you so much for taking time off and joining us and sharing this information with us as well.
Thank you for having me. Thank you for trusting me.
All right, see you.
We go back.
Yes, we do. See you in the gym Friday. Big up you. That's Dr. Bree. All right, so hopefully you guys got a lot of information there as we continue to blaze a fire right here. This is the Morning Jam. Shane Super with the building.